This is John Terr, President and CEO of the Boulder Chamber, and I welcome you to our first in our industry-specific feedback sessions on public health strategies and regulations around opening up businesses in our community. I first want to thank all of you who have been able to join us today for this presentation and feedback session. I also want to thank all of our Boulder County chambers and economic development agencies who teamed together to prepare this event and to make sure that we alerted our businesses across the county to this opportunity to get together. I further want to thank Boulder County Public Health and their team who have worked very closely with us and heard of our interest in making sure that we can open up our businesses as soon as feasibly possible, but also to do it in a safe fashion, both for our business leaders, our workforce, and of course, our customers. We will walk through a presentation today, which will provide some general information for all businesses on how to safely operate your businesses. But then for this session, we'll dig deeper into sort of general procedures for office environments. Now, I want to make it clear from the very start that there are some conditions that we will outline today which are mandated by the Colorado Department of Public Health and Environment. And those are procedures and regulations that we just cannot change. So just to be very clear. There's also some procedures and conditions that Boulder County public health officials will outline and offer that they feel are critical. So just to be clear that there are some conditions that are not something that we can change through this discussion. However, we definitely invite through the conversation and dialogue in this feedback session, any areas of gaps or concerns that you would have with some of the regulations. And we definitely invite dialogue on strategies for how best to comply with some of these public health mandates. So without further ado, I want to make sure that I thank again our public health team for their partnership in this and introduce Zach Swank, who is the Business and Events Liaison for Boulder County Public Health for this COVID-19 period to take us through the rest of the presentation. Zach, thank you for being with us and thank you for the partnership, and I hand it off to you.
Thank you, John, and thanks to the Boulder Chamber as well as the other chambers and all of the other economic development folks and our city partners who have helped promote and put on this webinar. Today, we'll go over what we're going to talk about. Matt, next slide, please. So a little bit of an update on our current status and timelines for businesses. We'll go over an overview of the compliance checklist and what that is. That Boulder County Public Health has been working on. We'll also have a discussion on specific challenges and solutions for office-based businesses, as well as an opportunity for you all to ask questions and give feedback, and we'll answer everything that we can. I anticipate that we won't be able to answer every question you have at this session, but we will do our best to get back to you with the answers as soon as we can. So this webinar is sort of both a general catch-all and also specifically for office-based businesses. So for example, law, engineering, accounting, administrative, other professional offices, nonprofits, etc. So we have heard, Boulder County Public Health has heard through our chamber partners, through our other economic partners, and from businesses directly that you all know your businesses best, obviously, and you have a strong sense of the ability to figure out some of the safety best practices. And so we want to give you a seat at the table here through these feedback webinars to help guide the implementation of both the current stay-at-home order under Boulder County, as well as the safer at home order that we're expecting to be in place in Boulder County on May 9th. We also want to provide clarity. There's a lot of information coming at all of us these days, and we want to be as clear as possible for you all of what you need to do, while avoiding blanket policies. Each business is different, each situation is different, and the stay-at-home order was very much a blanket policy, and we're moving into the safer-at-home order that is a little more precise and surgical in precision in terms of what businesses can do. We also know that everyone is looking for a vision of the future and what the process is going to be, specifically for events, and there's lots of questions on masks and other PPE, as well as a need to build public confidence in the safety measures that businesses have in place. So in general, I just want to recognize we've heard all that feedback, and much of what you're going to hear today is in response to that feedback. So timeline, there've been a lot of orders flying around, but here's sort of the simplest version. As everyone knows, we've been under the state stay-at-home order since late March, and at the end of April, Boulder County extended that stay-at-home order with the addition of including curbside for retail. As it currently stands, Boulder County stay-at-home order will expire on May 8th, and then we will revert to the state's safer-at-home order. But the long-term outlook, I think we all saw the stay-at-home order evolve. There are 4 iterations of it that happened over the month that it was in place. We can expect the safer-at-home order to evolve as well as clarifications are issued, and as we get feedback from businesses that say, hey, actually, no, this, we see what you're trying to do here, but this doesn't work, or there's a better way to do it. So I fully expect the state's safer-at-home order to evolve, but really in the longer term, we are going to be under some version of this until we have a vaccine, until we have treatment, or until we have herd immunity. So that's going to be months, and I think that there's this tendency that we all naturally have to hope and assume that things, next week or the week after are going to revert right back to the way they were in January. But I just want to, reiterate to everyone to brace for that. We're in this for the long haul, and we're going to be dealing with some version of a modified work life and lifestyle for months until one of those 3 conditions is met. So where we are now, to reiterate, we are still stay at home here in Boulder County. The only change from the last 5 weeks is that curbside is allowed for retail, and we have guidance on bouldercounty.org on the COVID page about curbside, and we're all anxiously preparing for safer at home. So what is safer at home? So continuing to stay at home as much as possible. That's first and foremost. We're going to be presenting, what changes and, the requirements for that, as well as some best practices. But I think it's really important to remember that the virus has not changed. It is still just as contagious as it always was. And some of the most effective things we can do, hand washing, wearing a face covering, and then just staying at home and avoiding unnecessary activities as much as possible. So before we get into the the nitty-gritty of what you can do and can I do this and is this allowed, I think the guiding principle that we all want to follow in our personal lives and businesses is safety, and avoiding possibilities for contagion as much as possible. So safer at home has changes for retail, field services, personal services, limited healthcare settings, and offices returning to up to 50% workforce. So now I'm going to turn it over to my colleague, Matt Hannon, who is the liaison specializing in office-based environments.
Great. Thank you very much, Zach. Good morning, everybody. My name is Matt Hannon, and I am currently acting as the business and events liaison for offices, as well as golf courses, landscaping, and a couple of other sectors. But today we'll obviously be talking about offices. And so I'm going to go over just a few guidelines, requirements as you return to the office setting in the coming days and weeks that are really best practices to go through. As Zach mentioned, the stay-at-home order here in Boulder County is extended through midnight on May 8th. May 9th is a Saturday, so a lot of you will probably be looking at returning to offices as things stand, probably on Monday, May 11th. So that's kind of a date you can kind of mentally circle for the moment. But as we return to our offices, we'll be looking at 50% max capacity. That means obviously if you have 200 people in your office, then up to 100 can return to the office setting. 20 people in your office, up to 10. Ideally, less than that would kind of phase in back to work. So if 50, 60, 70, 80% of the office can still work at home, we do think that would be kind of a best practice, safer for everybody. And then those that need to be in the office can obviously be there. But if you continue to work at home, if possible, that would be best. Daily symptom checks. So that means screening employees for any type of flu symptoms every morning before they come to work. Some offices I've heard of are doing temperature checks for employees as they arrive to work that morning. They're getting their temperature taken, make sure that they're kind of in a healthy setting. Others are just kind of checking in, making sure that you don't have any type of flu-like symptoms, no cough, no fever, stomach's not feeling under the weather, anything like that. Modifying the flow of traffic through multiple doors. So this is once you're actually in the physical office setting, having a couple of doors open. If you're in an office that only has one door, you obviously can't do that. But if you have a couple of doors in your entryway, keeping those doors open and marking one for entrance and one for exit means that less people will be passing each other through kind of a tight setting. So that's something that both the state and the county are suggesting. Proper ventilation is also really important. So looking at your HVAC system and talking to maybe your facilities manager, making sure that those are working well and have nice clean air filters is really important. Ideally, you have the windows open as well. I normally work in the efficiency sector, and we like to have office equipment working as efficiently as possible. But in these trying times, you'll want your HVAC systems working, ventilating air properly, but also ideally keeping doors and windows open just so that you can get really good airflow going throughout the facility. And then conducting cleaning with increased frequency. There's not really any exact guidelines for what exact frequency means, but it would be a very minimum 2 times a day, I would say. That means wiping down really these high touch areas, we call them. So that would be if you have a break room that people are using the sink, using obviously opening the fridge, using the microwave. That could be a copy machine. If you have a central printer in the office, you'll really want to be cleaning those down quite frequently, especially if you're in a large office setting and you have dozens or up to hundreds of people in the coming weeks that will be passing through there. Cleaning those really, really well. And obviously bathrooms, doorknobs, those things should really get kind of that special attention because a lot of people are going to be touching those throughout the day. And so if you can come on get some kind of schedule where maybe on an hourly basis, every couple of hours, a different team comes by and really thoroughly cleans those high touch surfaces, that would be best practice. So moving on to a couple of other points. Signage is really important. Everyone goes into restaurant bathrooms and sees those signs that employees must wash hands before returning to work. Having those signs in every office bathroom, in every break room, in places where people walk by on a frequent basis, just kind of as friendly reminders that obviously health and safety are very, very important right now. And to continue to wash hands, continue to stay 6 feet apart, continue to wear masks is all really important. Having digital files over paper, fortunately in the year 2020, most things are done digitally anyways. But if you can minimize the amount of paper that you're passing between colleagues or anything else really, and trying to keep things online, that would be another best practice. Most of you are on this webinar or obviously work in an office environment. I'd imagine we have a lot of office managers or HR folks on here. So assigning a coordinator, and that could be you because you're obviously taking an interest in this and are maybe kind of the point person for this response for your office. But having somebody that's really kind of well educated on these guidelines can help to spread information across the office as to what best practices are, and can be kind of the one that everyone goes to if they have any concerns. It would really be beneficial so that there's one kind of main point of contact that everybody can relate to it in the office. And that coordinator could also, if in a really big office setting, if you're only, a 5, 10, 20 person office, you don't really need teams. But if you're, a larger office of a couple of hundred people, then maybe having, teams of 2 or 3 on a cleaning schedule, organizing something along those lines, so that, a team of 2 or 3, 1 day a week will be taking on the responsibility of going and cleaning, the break rooms or desk surfaces a little bit more frequently, would really be beneficial. That coordinator could also kind of increase the communication and reminders around the office. So you might have a once a week check-in or meeting with your office, but you can send out maybe 2 or 3 emails a week, just kind of friendly reminders to folks, in terms of best practices. Continue to wash your hands, continue not to gather in the break room, stay 6 feet apart. You don't want it to be overkill, but at the same time, if ever there was a time to have a little bit of overkill in terms of communicating these best practices to your office, is probably right now, and the month of May, maybe into the month of June. So increased communication and reminders is really important, just to keep people, kind of on their toes and letting them know that this is still a very, very important time in this virus, during this pandemic. Curbside or outdoor drop-offs and meetings. There isn't really a time to gather, all in the one meeting room for your weekly meeting and crunch in there. This is a time that hopefully much of May will be beautiful weather. And if you have the ability to hold a meeting outside, around a picnic bench or under a tree somewhere, it's not a bad time to do so, weather permitting, of course. Also, if you're, a law office or another professional office where individuals might come in for a meeting, or they might come in to pick up some paperwork. The normal protocol would be they'd come through the door and they'd greet the receptionist and they come into your office. This is really, an important time to ideally let that person know that they've arrived to your office, and maybe go out to meet them outside, do the paper handoff outside. Try to keep as many people out of the office as possible, and in more of an outdoor setting, just because it's a lot easier to transmit the virus when you're in those enclosed settings. And then obviously just kind of wrapping everything up with that proper social distancing and mask and face coverings. Just like when you go to the grocery store, just like when you're walking on hiking trails, you're going to want to keep your distance from folks in your office as best you can. That could mean, if you're in a large kind of open office space, maybe if you're at 50% or less capacity, you have every other cubicle is staffed with somebody. Or if you're, even in an even bigger room where you don't have cubicles, potentially putting up some of those kind of plastic or glass barriers that you've seen at the grocery store, that might be a necessary step to take. Then obviously mask and face coverings. They're not just for when you go to the grocery store or running your errands around town. When you're interacting with your office mates, you should be wearing those. If you're spending a couple of hours in your enclosed office with your door closed, you don't necessarily have to have it on all the time, but it's certainly a best practice. And it is going to be, I believe it's required in the city of Boulder now, and Boulder County is working to make that a guideline as well heading forwards. So compliance, these are just kind of checklists that go over what I just spoke to, a number of those bullet points. So compliance with the orders is mandatory. These are public health orders that were kind of state implemented first, and then the county has kind of taken them upon themselves. And obviously the state's stay-at-home order expired back on the 26th, but ours is a little stricter, and generally you will go with the stricter or safer orders. And so our order is through May 8th. The checklists are voluntary. We'll go through those checklists in just a second. But it's really kind of a self-certification process that we're looking at. So, I'm not going to be coming out there and walking around your office and making sure that folks are wearing masks or that they're practicing proper social distancing. Although obviously we do receive a number of complaints every day from the public, and I would imagine that we will be receiving them from workplaces and offices as well, and we will be following up with those complaints. So just to make sure that everyone is kind of self-certifying and keeping their coworkers in check, because we really want to be as safe and healthy as we can heading forwards. These checklists can be looked at as kind of a compliance aid or a communication tool as well, just to kind of remind you that these are the steps that you should take. These are the proper protocols and guidelines, and then can be used as a communication tool. So as I mentioned, if you're an HR or if you're the office manager, then you can take these checklists and send them off, in an email form to your entire staff and let them know, hey, these are what needs to be in place if you're going to be working in the office. We're going to be cleaning more frequently. We're going to be, social distancing. Some meetings are not going to be held in the conference room because it's a little too small. So it's a great communication tool as well. And then there will be public posters, actually, both in English and Spanish, that will be available, I believe, next week. So I'll look for more information on that coming in the near future. As I mentioned before, enforcement is voluntary. I'm not going to be walking around finding offices for not being compliant. Don't quite have the resources for that. But we are going to be assuming that people are taking the proper steps and protocol to ensure that they are staying 6 feet apart and that they're wearing masks. That people are cleaning, much more vigorously than they have previously. So we're educating. That's obviously the point of this webinar. We're receiving, as I mentioned, a lot of complaints from the public about everything you can imagine. And so we as a public health department, as well as law enforcement, are doing a lot of education. If there are continued issues and we receive continued complaints about a specific office, we'll be following up, obviously, as I mentioned, with those complaints. But we might ask for the checklist, and then if things really go kind of over the top, there might be orders to close or civil action. But we really anticipate that people understand how serious this virus is. That we're not all just staying home for 6 weeks because we like to, and that we are going to start to do a phased opening. But obviously, we still need to be very cognizant of what's going on and make sure that we're taking all possible actions to mitigate any further spread of the virus. So workplace checklist, as I mentioned, offices will be at or below 50% capacity. If you can, have, only 20 or 30 or 40% of your office in, that's great. A lot of people back in, 5 weeks ago found it pretty difficult to work at home, but I think a lot of people have found a comfy chair and a nice setup with their laptop or their monitor. And so if people can work at home and they feel comfortable, then we suggest continuing to allow them to do so and kind of slowly phase folks coming into the office for a necessary meeting or for this or that. But if they can work at home, we still do encourage that. A set schedule for frequent cleaning. As I mentioned earlier, there's not really a set guideline. OSHA has a couple of suggestions. Obviously, the public health department and the state CDPHE feel that frequent cleaning could be at least 1 or 2 times a day for kind of a small office. But if you have 50 or 100 people in your very large office, then cleaning hourly or every couple of hours, wiping down doorknobs, wiping down counters, wiping down your own personal desk spaces is really a recommended thing to do. Then putting in a process for screening employees for their health prior to them entering the buildings every morning. Make sure that when people wake up, you either do a temperature check or maybe have a buddy system where you check in and make sure, hey, you're feeling good this morning, no symptoms. All right, as long as you feel good and healthy, come on into work. Obviously, if somebody starts to not feel well by 10 a.m., by lunchtime, by afternoon, you send them straight home. It doesn't matter if it's what you think might be a COVID-19 symptom, maybe it's just the cold, maybe it's the flu, any type of symptom whatsoever. An employee should be sent home immediately and then monitored from there. So an employee checklist, this is kind of for employees, and obviously as an office manager or HR professional, make sure that workspaces are minimum 6 feet apart. I would imagine most employees don't really want to be working right next to their colleagues anyway at this point. So making sure that everyone is keeping a safe distance. ensuring that employees have access to masks, gloves, and cleaning supplies. Maybe employees knew where the cleaning supplies were under the break room sink or in the supply closet previously, but giving them access to those supplies or encouraging them to bring their own supplies too, honestly, so they're not all touching the same bottles, could be really beneficial, and really just kind of being obsessive about the cleaning. Wearing masks and gloves also is going to be a requirement heading forwards, because they are going to be workplaces, just like a grocery store is a workplace, and there's people interacting. An office is a workplace where people are interacting. Obviously wearing gloves, typing on a laptop or a computer all day isn't ideal, so that one's kind of a gray area. But wearing masks is highly recommended. And then ensuring employees have the ability to work at home. At this point, most employees have been working at home for weeks. They probably have a good setup and a good way of doing things, but making sure that they can continue to do that as much as possible is really a best practice. And then customers, offices don't see as many customers as retail does, or the food service industry, but putting a process in place for those in-person or client meetings, that could be, just saying, we're not allowing customers or clients into our building, and we're going to meet them outside at the picnic table, whether dependent, or we're just going to do a handoff at the curbside. So having some kind of process in place to make sure that they're staying healthy, and obviously any visitors wear masks and other protective equipment when entering the office or encountering employees. So it's about 9:30 now. I do want to make sure we leave plenty of room for questions, because I'm sure there are plenty of those. And as Zach mentioned earlier, there's gray areas. This is really an ever-evolving thing that we're going through, pandemic that we're going through. And so we're going to answer our questions as best we can in just a couple of minutes. But there are questions I'm sure we won't have the answers to. So we'll do our best to research those and get back to folks. But for the time being, feedback and listening. Feel free to write in to the comments section and Q&A section any feedback or comments you may have for us. Let's see, what feedback do you have about the checklist? What challenges does your industry face in complying with the Safer at Home order? Is there value to a weekly industry work group? There's something to think about. But the checklists, are there any specific modifications or additions that you might like to see? Any gaps that we might be missing? Of course, there's things that we think of that offices are thinking about, but as an office professional, it might be on your mind and it didn't even cross our minds. Are there areas of operation that are not covered? And is this checklist valuable to you? Is this something that you really think that you can use, that your employees will use and will take seriously and stick to for the coming weeks and months? And then what else is needed in that checklist?
And Matt, chiming in on the checklist, so that everyone, the checklist that Matt keeps mentioning should have been sent out to you with your pre-webinar materials. It will also be sent out again after the webinar. And at this point, it is in draft stage. We hope to have a final on Friday. If you can go ahead and just comment directly on that Google Doc that was and will be shared with you again, that would be great. Again, we really do want your feedback there, and we'll take everything under consideration. So the best place to provide feedback on that checklist is directly in that Google Doc, the link which you should already have, and the Chamber will send out to all attendees after the webinar. And as John correctly noted, some of the items in that checklist are mandated by CDPHE. Some are best practices, but put in whatever comments you have, and we'll make adjustments where we can.
Great, thank you, Zach. Industry challenges as well. What challenges does your industry have with a Safer at Home order versus the Stay at Home order? And what support does your industry need with a Safer at Home order? So there's a couple of things to consider. And then a work group. Is there value in a weekly COVID-19 compliance work group? This could be, an hour check-in meeting once a week where folks get together and discuss some of the successes or challenges they've had. It's great for idea sharing. You could cover best practices, what to do if employees become sick, certain safety procedures that may be working that you think could be really beneficial for other office industries. And then, who would you like to hear from? It could be public health professionals. It could be folks from the state, potentially from OSHA or other federal organizations. So this could be really beneficial just to bounce the ideas off each other and know obviously that you're not alone at all in this. Everyone's in this together. We're all trying to get through these really tough times, and we will get through these tough times. But if we can work together to make life a little bit easier and less stressful, then let's do that. So questions or suggestions? We have a call center through public health. The number is up there. There's an email address as well, covidviolations@bouldercounty.org. We look at we take in all these phone calls from Monday to Friday, 8 a.m. till 6 p.m. We look at all of the emails, whether it's a suggestion, whether it's a complaint, whether it's a concern, whether it's a comment. We'll look at it, and somebody, myself or a number of other public health professionals, will get back to you. Our job is to really make this process as easy as we can for you. We know it's stressful for everybody, and you've been really patient, and we appreciate that. And so anything that you think that we can do to help, please let us know. And then we'll be holding another session similar to this on Tuesday the 5th, 9 a.m. There's a link there. But if you go to the Boulder Chamber's website and just scroll towards the bottom of the page on the left-hand side, you'll see a number of red boxes that are for this and a few other sector webinars, such as retail, food service, manufacturing. And so this will be kind of a repeat and an educational session 5 days from right now. And then where do you go for information? So lots of information out there. Can be overwhelming, but bouldercounty.org has a lot of great local information. Your local chambers of commerce, whether you're in Boulder or in Louisville and Longmont, the chambers of commerce are also doing a great job getting the information out there. We really appreciate their support through these times. Industry associations, depending on your industry. As I mentioned too, OSHA's got some great information, as do a number of other federal regulatory bodies. Licensing agencies. If you're on your city news blast, I'm sure you've been getting news through your city communications. And then the big one that a lot of us kind of refer to is covid19.colorado.gov. This is the state website that's got a lot of really good information and up-to-date information about protocols and guidelines for how you should be opening your business and how things should be going around the office once you get back into that normal work mentality. So with that, I believe that's our last slide. And I think we can open it up here for the next probably 20 to 25 minutes for questions. And I will do my best to answer them. And we have a couple of other professionals here, including Zach, that can answer whatever you may have for us.
Great. This is Corinne Waldo with the Boulder Chamber. I'm going to try to filter through some of these questions and ask them on behalf. We had quite a few questions about the obtaining of PPE when people are in offices are having a hard time finding those supplies, whether it be masks, gloves, and approved cleaning supplies. What are some of your recommendations for businesses to obtain those supplies?
Yeah, thanks, Corinne. Definitely a challenge. It's been a challenge since the start of this pandemic. It remains a challenge. Unfortunately, there are it's just a supply and demand problem. So we are working on developing a list of recommended sources for PPE. These would not be necessarily vetted sources, but just places where we've been able to obtain them. However, we do anticipate that even our sources will be overwhelmed. If we think about the challenges that we've had getting PPE for just the limited business and the healthcare operations that's been in operation already, and now we're looking at multiple states across the country and more to follow, looking at opening up. This is going to remain a challenge for us, for everyone. I would recommend continuing to do your own searches, looking for where you can find it. We will have that list out next week, but do not wait for us to get our list out. Keep looking. Unfortunately, it is a challenge, and it's going to remain a challenge for some time. we'll do our best to share the sources that we know of where they're available and assist businesses. But yeah, it's just going to be a challenge.
I'm going to add also that there's some statewide associations and resources that are looking at a marketplace for supplies. So as soon as we have information on that, the chambers will be sending that out as well, whether that's needing plastic barriers or other supplies. We're going to be creating there's going to be creating a marketplace statewide for some of that as well that we'll get out.
And I see a question here about, given the unavailability of masks, using a folded cloth. Yeah, so, certainly for an office-based environment, having a face covering, is going to be helpful. And, offices are not required, nor are we encouraging offices to wear medical grade masks. We want to reserve those masks for the medical professionals. But there's lots of great resources out there, the Colorado Mask Project and others that have great recommendations on how to manufacture your own face covering and how to make sure that face covering is as effective as it can be.
Okay, we have another question. Is it better to have Monday, Wednesday, Friday, and Tuesday, Thursday schedule, or a Monday, Tuesday, Wednesday, and Thursday, Friday schedule? Or is there no difference with proper cleaning in place?
I'd say that if you're doing cleaning, you want to be cleaning daily, that's for sure. Ideally more than once a day. So depending on, as I mentioned, kind of those high touch surfaces, that's where you really want to concentrate. So, you have to do a total, intensive office cleaning twice a day. No, but I'd say that, you should do a pretty good office cleaning once a day. And then those high touch surfaces in break rooms and bathrooms around copiers and printers, really, every couple hours, if multiple people are going and using those, using the break room or using the copy machine, then it would be ideal to wipe that down. And it doesn't need to be, hours and hours and hours, but going and giving it a spray and wiping things down as much as you can is really beneficial.
Okay, we have another question. What should an employer do if a certain employee calls in sick once each week or returns the next day with no symptoms? We'd love to trust each other's integrity, but what do we do if we suspect that they're being abusive of sick policy or that they do have symptoms? Can we do anything?
This is a tricky area for sure. What's happening and what we're seeing is that, healthcare and employment law are mixing in new ways here, in ways that are unfamiliar to to employers. This particular scenario, obviously, you first want to approach the employee with positive intent, right? And ask what's going on. Need to be sensitive to the regular HIPAA privacy requirements, but there are guides out there, and we can share some after this webinar of how HIPAA and COVID apply in this sort of new uncharted territory. But yeah, that's I see how that can be a problem. I would start by approaching the employee, sharing, hey, this is what it seems like is happening to me. Can you share a little bit more what's going on here, and take it from there. And then, if you need additional resources, some of this does diverge into employment law, and there are resources available from the Colorado Department of Labor.
Great. We have another question about plastic dividers. I have seen plastic dividers at some businesses. Are there guidelines for these dividers, types of plastic, thickness, so forth?
Not that I'm aware of. These are obviously the plastic dividers. You see them in places like banks traditionally, but a lot of grocery stores have been putting them up. I think that putting these dividers up, it's really more just making sure that there is that divide. So it doesn't necessarily need to be like, a half-inch thick plexiglass or anything like that. It's just making sure that there is something between two people that will stop the spread of any sneezing, coughing, or really just a deep breath. So as long as you have some kind of plastic divide up that covers, a large amount of surface area between two people, that should suffice. But if you can really be keeping that 6 foot minimum distance between people at all times, that's really preferable.
Okay, there's a question. At the Town of Erie trustee meeting, they mentioned that Boulder County had resources to help small businesses acquire needed PPE and disinfecting products. Are these the same resources Zach talked about, or are there additional?
Yeah, same resources. Look for information coming out next week.
Okay, we have a couple questions about the access to the checklist, and I will answer that one. We will be sending out an email to all registrants of this webinar, just like we did last night and this morning, with a link to the recording of this video, the checklist, and any additional resources that we mentioned. And then we'll follow up with the final checklist and some other materials later on. So if you didn't get it, we will send it to you following this webinar. All right, we have a question here. I hire veterans and others with disabilities. How have the needs and issues been included in business reopening practices? Is that something you can answer on this webinar, or are we gonna have to get additional feedback from others in public health?
Vulnerable populations are specifically called out in the state's Safer at Home order, and they cannot be compelled to come into an office. And businesses employing vulnerable populations, the definition of which is in the state's order, need to provide reasonable accommodations to allow them to continue to work, but they cannot be compelled to come into an office.
Okay. We have a question. John, I actually think this would be a good one for you, and then anybody from public health can answer as well. Is the chamber exploring changes in and support regarding insurance coverage in this new area, liability if folks feel they got sick by an office space? I know we had a conversation about this morning.
Yeah, just coincidental. And this certainly has been an issue. We are now reaching out to some of our legal partners and asking them this very question. What we're hearing right now is that there's just no settled law in this space. And so we are going to be trying to gather that information and hopefully have a forum specifically on legal liability associated with COVID-19 exposure for your customers and for your workforce. So we will stay tuned for that. But again, what we're hearing is that there's no settled law on it, and therefore probably the best guidance right now is to follow the public health guidance.
Okay. We had a question that came in via the chat about if sanitizing wipes aren't available, what spray cleaners are best to use for cleaning? Are those listed in the document and so forth?
So you want something that, soap and water works great. For hand sanitizers, that type of sanitization, you want at least 60% alcohol. Properly used bleach mixed with water can also be effective, but soap and water is really one of the most effective.
See, are there any other questions out there?
I see a question on veterans and disabilities are eager to work, or excuse me, veterans with disabilities are eager to work. They do not wish to be excluded and seek to go into work. How can this assumption that they do not wish to work be changed? The assumption is not that they do not wish to work, and they absolutely can work. It just needs to be from a remote environment where folks who are most vulnerable, with pre-existing conditions, et cetera, are not, being unduly exposed and risking their health. Depending on what the disability is, they may not qualify as a vulnerable person. So, for example, someone with a bad back, is not going to fall on that list of vulnerable individuals.
All right, we have, do employers have to provide take-home laptops to office workers that are working from home off of their personal old laptops that slow down their productivity?
That is not something that is spelled out in the orders. Obviously, it would be incumbent on the employer to, provide the conditions for their employees to be able to work. But the order does not get into a level of specificity of, does it have to be on a work laptop or a private laptop? Based on the question, it sounds like it would be more productive to provide laptops to your employees, but the order does not get to that level of specificity.
There's a question, can we refuse an employee's wish to work at the office if we know they have a high-risk condition?
Yes, I believe you can do that, especially if you feel that that employee is sick at all. And there obviously this virus, there's a lot of people that have COVID-19 that show zero symptoms, are asymptomatic. And so if you feel that employee could be really, could either be sick or could be a high risk employee and that they have pre-existing health conditions and you're in a really large office environment, then you could provide guidance to that employee on how they can best work at home. Because they're really not just looking at the health of that employee, but you're looking at the health of others throughout the office as well.
Do we have any other questions out there? Right now I'm not seeing any in, oh, yep, here's one in the chat. We had a question about cubicles and that changes the 6-foot standard. So what do we need to do about cubicles?
Yeah, so cubicles, so it's kind of an office-to-office situation where, kind of depending on what your layout is, but you should really be looking at that 6-foot minimum. So if your office is only at 50% capacity or less, then you shouldn't have a room full of people in cubicles that are only, kind of 4 feet apart. If, most of the, half these folks are working remotely, which they should still be doing if possible, then I think, maybe having somebody in every other cubicle could make sense. Or find a way to staff people in those cubicles kind of on a general schedule so that maybe this, this line of cubicles is in, Monday, Wednesday, Friday, whereas this one over here is on Tuesdays, Thursdays. And then, kind of having the flexibility to play around. I know obviously people have specific cubicles at their office space. They have their pictures and everything set up. But, if you can find a way to minimize the amount of people that would be working in those cubicles so that it's less than 50% capacity, then that would be ideal.
Okay. So there is a question, we've been getting this question about, there's some businesses, nonprofits in particular, whose industry descriptions are complex. They have office space, they have outreach in the community, they have public space. And looking through the upcoming list at the Safer at Home, it doesn't seem like their industries are necessarily addressed all at once. What is your advice? What are parts, how can we answer some of these questions that are coming in about this? Summer camps, things like that.
Yeah, so there are a lot of gray areas. There's no question that this is not a black and white thing. And so if you have a really specific situation that doesn't fall under any of those categories, I think that you should reach out to us directly and we can talk to you one-on-one and figure out what the best situation would be for your specific office and your specific workplace. I had the email down here, covidviolations@bouldercounty.org, or that call center number. Feel free to reach out through there, and then myself or another public health professional will reach out and we can discuss that kind of one-on-one on the phone.
Also, yeah, many businesses, picture even like an HVAC technician, they have an office too, right? They provide field services. So they would follow the office guidelines for their office, and they would follow the field service guidelines for their field service operations. So, for businesses that cross, sort of the buckets that the guidance have been broken out to, you would apply the guidance that is most appropriate to that portion of your business. But it's not uncommon that, folks would also work in the field while also having an office.
We have a question. I've had several businesses refuse to hire or allow anyone over 60 to work. What are the rules around this? Are there any regulations to balance these recommendations?
Yeah, so all of the anti-discriminatory laws and regulations still apply. So if businesses are refusing to hire someone based on their age, then I'm no legal scholar, but that pretty much sounds like age discrimination to me. So that would these orders do not change anti-discrimination laws.
Okay. Let's see, we can do one or two more questions. There's some ambiguity for us to whether, as a financial planning, we're considered essential or non-essential. Does the safer at home order apply to both non-essential business and those that consider themselves essential?
Yeah, so this order starting on May 9th is a safer at home. So essential or non-essential businesses can go back to work, obviously putting in those strict social distancing guidelines. So yeah, if you're like a estate planner or something that's maybe not considered an essential business right now, starting May 9th at the moment, of course that could change, but that's where our plan is for the May 9th shift to safer at home. Then you would still be able to go back to your office setting, even though you're considered at the moment a non-essential business.
I should add that there do remain a couple of businesses types that still cannot open fully. Restaurants, bars, etc. Those are clearly spelled out in the order. If you have any questions of whether or not you're there, but certainly restaurants and bars can continue to. I'll just run through the list here. Restaurants, that type, bars, and that type of businesses, cigar bars, gyms, except for some limited purposes, which goes deeper to in the order, movie and performance theaters, opera houses, music halls, casinos, and horse tracks are the ones that are specifically called out as cannot open.
Yeah, so that would be all the obvious places where people congregate and would be really easy to transmit the disease. But generally in the office environment, then you should be okay to return to work.
All right, we have one more question in the chat. Do HVAC filters need to be replaced more frequently in the coming months?
Yeah, that's a good question. I'd say if you want to err on the side of safety, then having a cleaner air filter, the better. So I would err on the side of if you change your air filter every 3 or 4 months normally. Maybe you do it every 2 months to be on the safe side. Maybe costs a little bit extra money, but I think for the peace of mind, but also for the actual safety reasons, it would be a good idea to do that.
Also, this raises a good point. Not every air filter is the same. They come in different grades. The higher quality air filters will filter out more particles, including viruses, to varying degrees, depend on the grade of the air filter. You want to be careful to make sure that your HVAC system is designed to handle the most restrictive air filter, if that's the option that you're going. But it is something else to look at when choosing an air filter, is that the lowest grade, cheapest air filter is not going to do any filtration for you for viruses, whereas some of the higher ones can be effective at filtering viruses.
All right, seeing as no more questions, please continue to send your questions to the links that they said. And we did record this webinar, so we'll be sending that out. And then John Terry is going to close it out, so we can have a great rest of our day.
Yeah, so just quickly, so first of all, just to be clear, these were very important questions that you asked of our panelists. And implicit in these questions was important feedback for Matt and Zach and their team at Boulder County Public Health. So I urge you to make sure that you have on your schedule next week's education sessions for these industry-specific areas. So just a reminder to check in, because there may be additional information that would be helpful for you and your office colleagues. But I want to make sure to thank, first of all of you for checking in, to be a part of this conversation. Really important to have all of our businesses paying attention to what they can do to responsibly open up, to get business moving, but to do it in a safe manner. I also want to thank all of our Boulder County chambers and economic development agencies. This is a partnership. We're all working together. They're working very hard on behalf of our businesses and our local economies. And then finally, again, as part of this partnership, it is with Boulder County Public Health. They're helping us to stop this spread of this disease in our community, but they also recognize that with us, we need to get business moving and our economy rolling again. So let's get that going together. Let's make sure we do it safely. And I look forward to getting back to our thriving economy here in Boulder County. Thank you for paying attention.